بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وآله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك أنت العليم الحكيم. My topic today is about adrenal calcification. I will present a case of adrenal calcification. As you see here, selected axial CT scan images of a patient with adrenal calcification on the right side, and this is a calcification also seen on the left side of the same patient. What is adrenal calcification? What are the differential diagnoses of adrenal calcification? Adrenal calcification, it is not a rare disease, and it is seen in asymptomatic healthy patients, usually due to hemorrhage or TB. Addison disease also may have occasionally calcification. What are the causes? The causes of adrenal calcification is hemorrhage, infection, adrenal tumor, and others like Addison disease, Wolman's disease. Hemorrhage can be due to sepsis or can be due to trauma, adrenal pseudocyst, neonatal asphyxia, coagulopathy, and infants calcification seen after hemorrhage in 1 or 2 weeks. Infection can be due to granulomatous disease like TB or histoplasmosis or others. Adrenal tumors like neuroblastoma, adrenal myelolipoma, adrenal adenoma, adrenal carcinoma, pheochromocytoma, and metastasis. Others, adrenal Addison disease, or might be that Addison disease it is primarily due to infection and Wolman's disease. And let us see some example of adrenal calcification. Before the examples, what are the radiological features of adrenal calcification? CT can be evaluated by CT, by ultrasound, and by brain film. The CT is the most common modality used for the adrenal calcification to characterize it and the size and also the location, and it is better than the brain film. In children, neuroblastoma is reported the most common calcification in the adrenal mass. Post-hemorrhage, like adrenal hematoma, as we said, it is developed in 1 and 2 weeks in infants of after the adrenal hemorrhage and can be calcified. Some examples of adrenal calcification. You see, this is the brain film of the upper abdomen with bilateral adrenal calcification. As we said, the most common cause of adrenal calcification is granulomatous disease. In our country, TB is the most common cause. Other Addison disease or hemorrhage or other differential diagnosis. Here, this is infant with bilateral adrenal calcification on the right side and on the left side. The, the differential diagnosis is hemorrhage and Wolman disease, but Wolman disease is very rare storage disease. So the probably most common cause of adrenal calcification in this child, bilateral adrenal hemorrhage and calcified. Here you see pseudocyst, you see cyst in the adrenal gland in the right side and with curvilinear calcification on the right side. Here, this is dense calcification noted on the adrenal left adrenal pseudocyst. Here, incidental calcification in the right adrenal gland in this patient, probably infective or other causes. Here you see a granulomatous disease causing calcification in both adrenal glands more to the left side. Here, child with left-sided adrenal mass pushing the kidney downward and show calcification. And this is a neuroblastoma with a child with calcification. Here, this is an infant with bilateral adrenal calcification on the right side and on the left side, and this is proved to be Wolman disease. Wolman disease is primary familial xanthomatosis, and it is a storage disease, and it is a rare disease. Here, this is another patient with TB with bilateral adrenal calcification, more to the left side. And this the end of the talk, and thank you for listening. Hoping to see you soon.